Ivana Giuliani, a senior manager at the California Quality Collaborative. CQC is a healthcare improvement organization dedicated to advancing the quality and efficiency of patient care in California. One area that's gotten tremendous interest both nationally and among our California stakeholders is how to better manage care for the high-risk patient population, those with multiple chronic conditions and psychosocial needs that take up a disproportionate share of healthcare costs. To work on this really important area, we convened a complex care management action community. The purpose of this community was to bring together the leading organizations in California who are innovating in this area, both so that they could learn from one another to advance their own complex care programs, but also so that CQC could write down the promising interventions from their work to create a toolkit and spread in 2012 to other organizations. You're going to see a testimonial from one of our participants, Dr. Maria de Lima from High Desert Medical Group. She's going to share with you what they got from the action community and what has worked for them.
Our group is a full risk group. So for us, it behooved us to kind of put our money where our mouth was, is that if there were things that we could do to improve our patient care and therefore improve our patient care outcomes, the patients don't care about the measurements. Patients just care that they're in the hospital less or that they're feeling better. So that's sort of what made us focus on it. But some of the changes were really very concrete things that we learned as we started to look at our outcomes and how do we measure them and what do we do. So Becky, our queen of management and statistics, we were looking at hospitalizations and things, and we said, okay, well, we have a lot of COPD hospitalizations. What can we do to intervene with that? And it's like, well, whether the patient is enrolled or not, have they seen a respiratory therapist? Would they benefit from it? And I was like, okay, if we can justify the cost of one respiratory therapist and we can prevent 10 hospitalizations, we have more than doubled, the money back that the respiratory therapist could give us as far as benefit for the patients. So, we added a respiratory therapist, and we looked at a lot of our patients have those social services type needs that are not quite of the realm of a social worker, but really need a lot of the care coordination of, Meals on Wheels and advanced directives and all the other care things, applications for IHSS and so on. Somebody really needs to kind of hold their hand and say, this could benefit for you, be a benefit to you. Can I show you what's possible and you tell me what you're interested in? And so that was another real big benefit for us. Another thing that we did was, in looking at things, our turnaround time for our referrals was lagging because our case managers were just kind of, running on the hamster wheel as fast as they could, and therefore the referral process got slowed down. So we transitioned things over and adjusted workloads so that we pulled out the initial evaluation process to 2 dedicated people who all they do is intake evaluations, and then their other job, in case the intake process is slow, is to manage sort of the lower risk people. So they have routine people to call, but they specialize in putting together the package, tying the bow, and putting it forth to the next case manager. I think it's easy when you're confronted with so many problems to move around, and the nature of the job is that everybody needs something done now, so it's easy to kind of be frantic and less intentional. But to have somebody kind of tutor you through a little bit of a vision that helps, that part of your job is never going to change, but can the whole beast, sort of mature? And so for us, it was to keep us moving forward with a plan as opposed to sort of being reactive, being a little more intentional and proactive.